Hello, Bill, the knee pain guru. Welcome to the Monday, March 18th. We're going to talk today about how to get rid of knee pain in 3 simple steps. 3 simple steps. A lot of times knee pain gets complicated because it's confusing, because we're in pain. We're trying to figure that out. So today we're going to kind of cut through to the simplicity of it. We're going to be answering questions in just a few minutes. So if you do have questions about your if you have questions about your knees, what's going on with your knees, your diagnosis, your dealing with physical therapy, questions to doctors, whatever you have going on, this is part of these topics that I'm sharing information on, is about to kind of sort through that to make it less confusing, less like a big mountain trying to figure it out. So if you got questions, please put those in over in the comments section. And make sure to like the video, give it a thumbs up, like and subscribe to my channel, and turn on notifications for future videos. I do these a couple times a week, except for when I'm visiting Dad. And so last week we took off. So now what we're going to do is go into talking about how to get rid of knee pain in 3 simple steps. And what's fascinating to me is how many people suffer with knee pain because it's so complicated. They get stuck in the diagnosis. They get stuck in what the doctors have told them. They get stuck in how much pain they are in physical therapy or trying to exercise. And the mentality is you got to push through the pain. No pain, no gain. Pain is weakness leaving the body. You got to push through the pain. But what ends up happening, if the goal is to get out of knee pain, we have to understand pushing through pain to get out of pain is not going to get us there. This is like, we don't need letters after our name to figure this one out. We don't need to go through years of college to figure this out. The idea is you're not in pain because of your diagnosis. You're in pain because of tiny little nerves the width of an eyelash in your knee that are being squeezed, sending a signal to your brain that you have pain on a basic fundamental level. That's the lens that I'm looking through. That's the lens that I'm working with. So in order to get you out of pain, and this is just getting you out of pain, reducing the pain, moving you in the direction of being able to exercise. We're not completely disregarding exercise down the road, but we want to get the pain reduced enough so you can begin to move gradually and more, because the doctors are saying use it or lose it. Physical therapists are saying use it or lose it. You got to use the joint, and they're absolutely correct. But there is a fundamental step that's being skipped on the front end of this dilemma, this challenge that you're working with, that is not allowing you to get to exercise more and move the joint. So it's like a skip in the record, and you keep coming back to the place that you're in pain again. And it's because of the fundamental misunderstanding of how to get the knee out of pain. Okay, so 3 simple steps to getting rid of knee pain. First of all, you got to create comfort in the knee. And creating comfort is significantly different than sitting on the couch and doing RICE therapy. Rest, ice, compression, elevation. RICE therapy. Rest, ice, compression, elevation. You'll hear that from doctors and physical therapists. They'll tell you to take ibuprofen or some sort of pain-killing drug in the hopes that when you go to exercise again, that the pain's going to be gone. We have to create comfort in the knee first. The knee holds tension in intrinsic movements. This is a huge distinction. We have gross motor movement of the knee. The knee extends, the knee bends. And that's what we think of strengthening the knee in, that line of movement, extension and flexion. However, the pain is in the intrinsic movements, like that little movement, like a twisting and pushing as you're getting out of the car, or turning your body in bed to try to swing your legs over the end of the bed to get out of bed in the morning, or twisting to getting up from a chair at the kitchen table. These are intrinsic movements. They're not linear movements. Your knee is not bending and extending in those movements that it hurts. So what we need to do, instead of just rice therapy, we want to begin to create comfort. And what I'm talking about in comfort is working with those intrinsic movements, slight twisting, slight side to side, slight forward and back, slight apart and together, slight tilting of the joint. This is where the pain in the joint settles, where it hides. And what leg extensions, leg curls, and leg raises will never touch, because it's in the intrinsic movements of the joint. So creating comfort in the knee is the first step of the 3 simple steps to getting the knee out of pain. We got to get the pressure off of the nerves that are causing the pain. When we get the pressure off of the nerves, the joint relaxes. The tension in the joint begins to dissipate, and comfort is created. Pain is relieved. That is the first step. So what happens for the second step, it builds on the first step. These 3 simple steps aren't in isolation. They aren't in a vacuum. So when we create comfort in that first step, in the intrinsic movement in the joint, then we need to hydrate. We need to drink more water. Because what happens, just like with a sponge next to your sink, when you haven't used it for a while, and we have tension in the joint squeezes. It's painful. That's a natural response to pain. Any sort of pain, trauma, injury, accident, surgery will cause the joint to tense up to protect itself. Normal, natural response in the body to a threat. So now the joint squeezes. Well, look what happens in my hand once I start relaxing my hand. Imagine this is the joint, the knee joint, and I relax the hand, it goes from white to pink. That's because now the blood and the oxygen will begin moving into the joint to rehydrate the joint. Specific note here, anybody that's suffering with arthritis, all diagnosis of arthritis is dehydrated joint. So when we start creating comfort, step number 1 of the 3 simple steps, now the joint begins to relax. We drink more water. The water can get into the joint and begin lubricating the joint. When the joint's dehydrated, the joint wears and it creates more pain, which builds up that process of arthritis getting worse, the joint beginning to wear, and bone on bone, you're a candidate for knee replacement surgery down the road. So first step, we got to create comfort in the joint. Second step, we got to drink more water. It's important to drink more water. And the third step, this is going to sound super simple. I said it's going to be simple. We got to avoid doing things that cause the knee to hurt. Now, we have a life to live. We have to do things. We're parents, we're children, we have jobs. We have to move. I get that. It's not that we completely don't do anything. But here's what I've noticed, and this is a mental part. This is a mental piece, what keeps people stuck in pain, is that they will do things they don't need to do. There is an imbalance between what's essential that needs to be done in our life and then other things that are like, well, it'd be nice to get done. For instance, worked with hundreds of clients over the past 10 years. And what they will do is they want to get to the gym and they want to exercise. But what they do is they exercise at the expense of their knees. They will go and push their body. They already have this little voice in their head saying, I'm not sure if it's going to hurt or not. And they go to the gym and they push through it and they push through the pain because they wear it like a badge of honor and it ends up putting their knee in more pain. And it's not helping them. It's not helping them. So they end up getting stuck in pain. And it's like being on this hamster wheel. So they get stuck and frustrated and say, nothing's working. Nothing's going to help my knee. I've done the drugs. I've done the shots. I've done the surgery. I've done the physical therapy. I go to the gym. I do all of these things and I'm still in pain. So nothing's ever going to work. But if you go back to these 3 simple steps, 1, create comfort in the knee. 2, drink more water. And 3, avoiding things that hurt. 3 simple steps and you will move yourself. The knees will move out of pain very fast because you're lining yourself up with the capacity of your nervous system to heal itself, and you're removing the blocks that is preventing your body from doing so. Okay. Type in your questions. I see a few of them have come in. If you have questions about your knees, what's going on with your knees, please ask those over in the comments section. So now I'm moving on. Oh, remember, give the video a thumbs up, like and subscribe to the channel, and turn on notifications so you know of future videos on topics around knee pain. Okay, Renee said, would you recommend a Synvisc injection? Renee, let's go back to the concept, the sponge. The body is holding tension. It's squeezing to protect itself because of the pain. Now, your knee is doing this, and we're trying to stick a needle into that joint that's already tight, that's already tense, that's already in pain. We need to relax the joint first. And if the pain goes away by relaxing the joint, the question is, would you want a Synvisc injection? If the pain is reduced by creating comfort, working with the intrinsic movement, do you still want the injection? And this is where things get convoluted and misconstrued, because the goal is to get out of pain. You don't want the injection. You want to be out of pain. You think the injection is going to get you out of pain. Does that make sense? Okay. I had microfracture surgery September 18th, which wasn't successful. I've had 2 subsequent opinions, too young for knee replacement, and the pain is debilitating. You are exactly who I was talking about. Like these 3 simple steps is exactly tailored to a person like yourself. And meant to say original issue was a torn medial meniscus. Have tried 2 cortisone injections, no success. It's common. It's common because the cortisone injections, the Synvisc injections is designed to give the knee some time to heal. But if we aren't addressing the neurological pattern that's going on, causing the knee to squeeze to begin with, it's not going to get out of pain. Make sense? Renee, give me some kind of feedback on that if you know what I'm talking about. I guess it was told to be a last resort. Yeah, they say knee replacement surgery is a last resort. That's all the doctors have. They have pain management. Notice, pain management. They're managing the pain until you're old enough to have a knee replacement, because the joint that they replace it with, made with plastic and metal after they saw off the bones in your leg, is only rated about 10 to 15 years. So they're hoping, the doctors are hoping that you can deal with the pain until you're old enough to have a knee replacement. So then they could do the surgery so you will die with the knee replacement in, and they won't have to replace it again. The strategy, the mentality of this is absolutely, you think like we're 2019 and this is the best the docs can come up with. It's what we got. It's what we're dealing with. You either accept it and you shift to adjust to see what you need to do to course correct, because that is their medical model. This does not make them bad or wrong, but understand you have to take the responsibility for your health in your own hands. That's kind of how it is. Okay. Ron says, would a torn ACL require surgery? Will it heal itself? I have had clients that have had torn ACLs reattached. The question is, torn ACL is a diagnosis. The tear can be partial. The tear could be full. Those are 2 different tears in the ACL. Partial tear, full tear. I had a partial tear 3 times before I tore it the fourth time and completely ripped through it. So if I would have slowed down and not continue to push myself, I believe my ACL could have repaired itself because it was partially torn. But I didn't. And I waited 4 times, dislocated my left knee 4 times before going to the doctor. And at that point, I had completely torn through the ACL. And from my perspective, I was in judo. I loved throwing people. I wanted to get back out on a judo mat. And in my mind, the surgery was going to fix it. So when the surgery was done, my knee, the problems in my knee were directly related to the ACL being torn. And in my mind, if they repaired the ACL, then all of that stuff goes away and I'm back out on the judo mat. It was partially true. They took out 2 pieces of meniscus, and the docs and the PTs did exactly what they said they were going to do. However, my understanding, my limited understanding at that time, 21 years ago, was that when they repaired it, I was going to be back to normal. And it wasn't the case. I still had swelling. I still had pain. I still limped. I had difficulty with range of motion. I had scar tissue in the knee and where the incision was made to take out the patella tendon to recreate the ligament in my left knee and the screws that went in my tibia and my femur. You know, so there was like layers of this stuff that the docs, honestly, they don't have time to tell you all of these things. It's not in their scope. So, depending if the ACL is fully torn or partially torn, it's going to be a different answer. If the ACL is fully torn, I've had clients where the ACLs have reattached. They took an MRI on the East Coast, and they did rehab, and they let the knee rest a lot, and then did an MRI. This was several years later after they moved out, I believe it was Washington State, and the ACL had reattached, which is cool. I believe the body is capable of healing itself. It has the infinite capacity to do so. But we have to set up the conditions for that to be the case. So there's the potential for the body to heal itself, but we have to make sure we're doing the right things. And the problem with an ACL tear, and I'm talking about a fully torn ACL tear, is that it just, we don't know what are the conditions, necessarily the conditions for it to reattach. And will it reattach at the place it was torn at? So there's layers and levels of that. So it's a little bit of a difficult question to answer. If you have questions, please put those in the comments section over on the side, and I will do my best to answer them. If you would like to learn how to create comfort in your knee, which is the first of the 3 simple steps, you can head over to my website, thekneepainguru.com, and take the 7-day knee pain reduction challenge. I'll put links in the video as well for you to do that to help you with relieving the pain in your knee. Okay, no more questions. Thank you so much for being here. Thank you for all those who have shown up and are watching this live as well as on the replay. We do these videos twice a week, one on Mondays at 9:55 a.m. Eastern Time and on Thursdays at 9:55 a.m. Eastern Time. Once again, give the video a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel, as well as turn on notifications where we will, for future videos that I'll be doing. This is Bill Paravano, the Knee Pain Guru, thanking you so much for being here. Have a wonderful day, and I will see you next time.